Good evening. Oh, I think that this is, oh no, it's good. Okay, good evening, class. See the volume, everything is all set. How are you guys doing? Okay, so hello, hello. Anybody there?
Good evening.
Okay. Okay, guys, so good evening again. So I hope you guys enjoyed this nice day. Still not so cold because later on it's gonna be winter time. So we're gonna have a very cold winter. So let's take advantage of still not so cold days. Well, today we're gonna continue with the urinary system that we started yesterday. And that will be it. That will be the end of this module. This is the last chapter. So as soon as we finish, we're gonna be done. And then we're gonna be starting a new chapter next Monday. So that will be a medical office procedure, something like that, I believe. Let me see the so yeah, medical office procedures will be next module. So during this weekend, I will be sending you the final exam for AMP, Anatomy and Physiology, and the materials for the next module that will start this coming Monday. I will keep you posted. Okay, so at the end of this class today, I'm going to tell you a little more about the exam for those who are not familiar with the way I test you guys. So we can kind of be in the same page. Okay, so without further ado, let's continue with the urinary system. So yesterday we were talking about the structures that makes up the urinary system. So today we're gonna continue with other structures, some internal structures, because the most important part of the urinary system is gonna be the kidneys, because this is the place where all these functions are going to be taking place. Which functions are we talking about? Filtration, reabsorption, and secretion. We are going to talk about not just the kidneys, but what are the name of those cells that makes up the kidneys? How they are so important, because they are the one who is going to carry all these functions inside the kidneys. We're going to see major structures within the kidneys and what is really going on there, because that is what is important. Remember, we talk about the kidneys. We have two kidneys, one on the right, one on the left. Remember that we know that these kidneys are located on the back, outside of the peritoneal cavity, the peritoneal membrane. So I have a picture that I just add. Remember, we talk about the location back outside of the peritoneal cavity. So let me show you how it works. So if you look, this is
Hi, good evening.
Hello, good
Sorry.
evening.
I'm gonna log back in when I get home, okay? Just got out of work. Just
Thank you,
wanted to
thank you.
confirm.
Just, yeah, whenever you have a chance, just if you have a
Okay.
signal, just follow along, no problem. Otherwise, you catch
Okay.
up later on. Because remember,
Okay.
these classes are being recorded, so you can go over. If you miss something, you can go back after the class and review the tape,
Okay. I
okay?
just wanted to confirm. That's why.
Thank you, thank you.
You're
Appreciate that, no
welcome.
problem. All right,
Okay.
later. So this is the part that I was talking about. Remember, this is a transverse section of the abdominal area. So here is when we can see from the top of the body. If we cut horizontally, transversely, remember we talk about these planes. This is the transverse plane. So if we cut something just the way that it shows this image, I'm gonna be drawing this picture right here on top. You can see this is a transverse cut. So we seen on top, so from the top part, we are seeing the body. So this is the peritoneal membrane. See, all these lines that I'm drawing right here are the borders of the peritoneal membrane. But inside is the peritoneal cavity. This is the cavity. Here is when we have all the organs, the internal organs. But one exception are the kidneys. So the kidneys are not contained within the peritoneal cavity. They are outside of the peritoneal cavity. You see, they are outside towards the back. So right here they are. So we work right here. See, this is the spinal vertebrae. So we go right here to these ribs to access the kidneys, This is a lot easier. We don't have to do it from the anterior part of the front. We do it from the back or posterior. Can you imagine putting a needle or cutting all the way through these organs and every single structure to reach the kidneys? You can imagine how much damage we are going to cause right here. Instead, we use the back. Why? Because there's nothing we can damage there. We just open through the skin. We pull up and down the ribs, and through that space, we are going to access the kidneys. Whether we have to remove the entire kidney, whether we have to just operate, do a surgical procedure, a surgical drainage, whatever the case may be, it will be a lot easier using the back of the individual. So that is basically what this picture can depict. Something a lot easier for you to understand or to comprehend where is exactly the kidney is located and what is it, the peritoneal cavity, the peritoneal membrane, what is all that? Because remember, these terms are totally new for you. And I just want to make sure that you do understand this. This is a lot easier for me to mention it, but when you see it, you get a better understanding of what exactly is being said. And that's what I want you to understand. Try to make these classes as easy as possible. Remember, considering that we're using all these medical jargon, this medical terminology, That is the one that kind of throw us off the path because there are many terms that are not known by you. I know them. I know most of them. So for me to identify this is a lot easier, but for you that you've been exposed probably for the first time, it takes a little more time, information, and particularly these diagrams that are going to show how they look like, where are they really located. I just add this particular picture to your slides because I found it in another lectures that I have. So I was checking them out, see if there is anything that, I might add. So remember, like the old saying, pictures tells more than 1,000 words. That's actually true. If I see something, I can identify it. If you are talking and talking and talking, probably not going to be able to understand that. Okay, so this is the peritoneal membrane that covers all the internal organs. And that's what, I wanted to bring it up to you so you can understand that the kidneys are outside. So it's a lot easier to work, to do anything to the kidneys from the back, from the posterior part of the body. So moving on. So we talk about these functions in particular, but we are going to be a little more specific when we are moving forward with this chapter. So the kidneys functions, production and excretion of urine from the body. Well, urine is not formed within the blood. So all these excess of whatever is in the blood, for instance, toxins, nitrogen, other chemicals, whatever the body doesn't need or have too much of it, including fluids, we are going to remove them through the kidneys. Remember, the kidneys are the filters of our body. So we need to know these definitions. So the liver is the detoxifier of our body because it removes all these chemicals as well. Remember, it's the place when we pass all these medications. Every chemical that we ingest is going to pass through the kidneys, through the liver, through all these organs. And each one of these organs is going to have a specific function to remove certain things. So if things were passed through the kidneys, now through the liver, now the kidneys are going to remove them. So that's how it works. Something that accidentally passed through one structure, maybe because it's not functioning properly, is going to move to the next. And that one might cut these toxics and they're going to be removing them. So that's basically what it is. So by removing all these excess of fluids, we are going to maintain water balance. Remember that even water can cause intoxication in our body if you drink too much water. You drink more than you consume. That's what I'm trying to tell you all the time. If you kind of ingest too many vitamins, too much of these vitamins, guess what? Toxics is going to intoxicate you. Too much, not good. Little, not good. So you have to be balanced. Remember, homeostasis. By removing excess of fluids, by maintaining this water balance, we are going to regulate blood pressure. Remember, blood is the amount, is all these liquid and solids that runs through all these blood vessels. So if I have too much blood, more than I needed, because too much water was ingested, it's not going to be good because the heart has to work harder to pass the excess of fluids. And if I don't have enough, the heart has to work hard to try to push this little blood, the volume of blood that's decreased due to the fact that we don't have enough fluids. But once again, we have to be balanced. We can't have too much of anything, not good. So drinking too much fluids is not good. Remember, we have to drink fluids accordingly. Accordingly to what? According to our age, according to our body mass, according to our daily activities. If I'm sitting right here in front of the computer teaching you these classes, why am I going to be drinking too much water? I'm not using it. How is that going to work? The water is going to enter in my system, but I'm not using it. And I keep on drinking and drinking and drinking. What is it that I'm going to be doing? Getting up from this chair every 5 minutes, go to pee. Because I have too much fluids and the body is not using it. So the kidney is working harder to remove all that with no need. Well, I'm putting these kidneys to work when there's no need for that. So again, there are a lot of stuff that we need to understand to keep our body balanced. Sometimes it's just the fact that we are not aware of certain things, we make mistakes. So we are the ones who put in things in our body that sometimes are not needed, or just because we think that they are needed. So remember, in order for us to start doing things, ingesting things, we need to follow certain diets. We need to follow the doctor's recommendation. Other than that, eventually, we're going to damage these organs, whichever the organ has to deal with all the removal of the excess of these products that we ingest. So that's basically what it is. So we saw this already. We know already that we have two kidneys, one on the right, one on the left. Usually the right kidney is lower than the left. That's normal. That is normal. Just for you to know. Remember, you can see the image right here. And you can see right here that this is the left because the patient is facing us. So we are facing the back of the patient. So we are in the same position. So we can say that this is the left and this is the right kidney. So the right kidney is a little lower than the left kidney. That is just because some anatomical structures within. No worries, just know that. Okay, so now we are going to move to, to explain these internal structures and external structures of a kidney. So it has lots of structures, as you can see. So we have plenty of them. So we have here 1, 2, 3, 4, 5, and this is subdivided in 2, and then we have 6, 7, and 8 structures. So each one of them, we're going to go over, we're going to see it in a diagram, in a picture, if you will, and we're going to be discussing what is it that they do, Where are they located? Within the kidneys. So that's basically what it is. So let's start with the renal capsule. The renal capsule. As the word implies, this is a capsule. This is a membrane that protects the kidneys on the outside, like a capsule. See, you have taken a medication that comes in a capsule that looks like a little cylinder, like this, and inside has the medication, right? So this looks like that. So the kidneys are protected from this capsule. It's whatever it protects the kidney on the outside. We're not going to call it a membrane, but we assume that is something like that. Every single organ is protected by a membrane or a capsule, just like an egg shell. It is what protects the content inside. It has to, remember, for protection, because these are soft tissue, very, very soft tissue, that any little movement, anything that can happen to our body, any small trauma can damage these organs. But because it contains this capsule, it's just like a cushioning on the outside, it prevents these organs from being damaged from the regular activities that we do. All minor traumas that happen to us. So this will be the capsule. So let's look at the image every single time that we're gonna look at this. So here we have all these structures. So this will be other structures. I don't see the capsule right here. What is the capsule? It's supposed to be somewhere. Didn't see it. Anyways, so I'm going to mark it for you. So right here, surround. Let me make this a different color so we can see it. So this is the capsule. No, it's just don't see it. So this is the capsule, which is covering the kidneys on the outside. Oh, it's here. See, I knew that I have it. So the capsule is the entire membrane that protects the kidneys on the outside. That's basically what it is. It's a membrane. I knew that I have it somewhere, but I was like looking for it. I don't know. So that's basically what it is. This is the capsule. So we're going to go over each one of these, and then I'm going to show you the diagram. Then we're going to have the hilum. Now, it says that the hilum is this notch where blood vessels and the upper part of the ureters are going to come in contact with. So this green part right here, the notch, it's like the entrance is this part right here. Because remember, the kidneys looks like a bean, and that little notch of the bean is where the blood vessels, the renal arteries, and the upper part of the ureter, which is called the renal pelvis, are gonna enter the kidneys. So let's review that. The hilum, see, deep notch entrance to the renal arteries and the renal pelvis, or the upper part of the ureter. So that's basically what it is. So we're going to move on. That will be the renal pelvis. This one enters right there. This is a funnel-shaped sac superior end of the ureter. So this is the one that we see right here. See, the renal pelvis. It's this part right here, because it's the superior part of the ureter. And this is like a funnel because it makes all the notch. And we will know why it is a funnel later on. Then we have the ureter. See, because it's this tube that drains urine to the urinary bladder. So moving along, let's go back to the lecture. So let's remove all this. Okay, so this is the renal pelvis. Just in a little bit, I'm going to tell you the renal cortex and the renal medulla, because these are the two major layers of the kidney. So these are the renal pelvis. Remember, this is the upper part of the ureter. But this upper part of the ureter has major calyces and minor calyces. So let's see those calyces right here. See the renal arteries? Well, let's go back to the notch, the hilum right here, when renal arteries are gonna enter, and the renal pyramid is gonna enter right there. So that's basically what it is. So now let's move on. The cortex. See, the cortex is the outer part of the kidney. So in this case, look at the kidney, the other diagram that I have right here. This part, all this part on the outside is gonna call, this is the cortex, the renal cortex. See? Anything that is inside the inner layer, which is this part right here, is the renal medulla. See? So that's what we have right here. The renal pelvis. Now we have major calyces, minor calyces. I'm not talking about that. See, the renal cortex is the outer region of the kidney, the renal medulla, the inner region. Now the inner region is made of renal pyramids. What are the renal pyramids? It looks like pyramids inside. So if you look right here, they are not well defined, but these are the pyramids. They look like pyramids. Like this, like this, like this. So if you look here in this picture, because this is more kind of defined, see? These are the renal pyramids. So the renal medulla is made of the renal pyramids. The renal pyramids right here. The renal pyramids right here. Oops. These are pyramids and these are pyramids. So that's what it's telling you, which is right here. Here we have the pyramids. Here we have the pyramids. Here we have the pyramids. The pyramids. It is made of the medulla, is made of the renal pyramids. That's exactly what's telling you right here. Here are not well defined. This is a real kidney, but it is highlighted. So it is very kind of difficult to see the actual pyramids, but in the diagram, we can see it better. So the cortex, once again, is the inner, the outer, and the medulla, the inner. But the medulla is made of the renal pyramids. The cortex is not made of anything, just that for now. Now, the renal pelvis, inside the kidneys, this renal pelvis, see this upper part of the renal pelvis, it is connected to some little drainages, some tubes. See, this is the renal pelvis right here. Funnel-like, see, it looks like a funnel because it's picking up all these. We have here the major calyces, all these big tubes. All these big tubes are the renal calyces. Now, and major calyces and the minor calyces are all these little tubes right here. See, they have tubes right here. So small tubes that are connected to the pyramids, small tubes that are connected to the pyramids, small tubes that are connected to the pyramids, and then it has a large tube, and then they drain all the urine right here because the urine is produced right here within the pyramids. The urine is produced here. The urine is produced here and it's going to drain to this small tube and then to this large tube, then to the renal pyramid, then to the renal pelvis, then to the ureter, then to the urinary bladder, then to the urethra outside. That's how it works. So we're going to have lots of structures right here within the kidneys that needs to be covered because the urine is produced somewhere within the kidneys. But how the urine is going to be drained outside? This is like those pipes from the bathroom, from the shower, from the kitchen sink. Where is all that water going to go? Well, it's got to have some pipes, some drainage, some sewer, right? So that's exactly what it is. The clean water enters through one of the pipes. It's not going to be mixed. And the dirty water is going to go through different pipes. So here the urine has to be drained, just like the sewer in our house. Urine is going to be produced right here in this area, in these pyramids, meaning in the medulla. It's going to be drained through these small tubes, then through these large tubes because it collects all down from all the pyramids. All the pyramids collects into the connected to a small tubes, then through a large tube, and then to the renal pelvis, all the way down to the ureters, then to the urinary bladder, then to the urethra, to the outside. So that's how this works. So I explained you already the pyramids and the minor and major calyces, because those tubes that are connected to the pyramids, the minor and then the major that is connected to the renal pelvis. So that's basically what it is. See, large tubes that merge to form the renal pelvis. Small tubes that merge to form the major calyces. See, we have first a little tube that drains the urine from the pyramids, then a large one tube because it collects urine of all these pyramids, So all this urine, and then they drain into this funnel-like structure. Remember the renal pelvis, all this urine is going to be drained right here through all these calyces, and then to the ureters, to the urinary bladder, to the outside. So they have a tract, just like the digestive system, has all these tubes, all these connected tubes where urine is going to be passing through. It's going to be produced within the kidneys, then we're going to drain them out of the kidneys, but it has to pass through all these structures. So that's basically how this is going to happen. Then we're going to talk about these microscopic structures. That will be, now it says right here, the renal columns. Oh, where are the renal columns located? Let's go back to the picture. So right here, so if you look right here, the renal columns are the one that separates the pyramids. See, these are columns. And these columns are projections from the cortex. These are projections from the cortex. These are projections from the cortex. So they separate the pyramids. That's what they give the shape to the pyramids. So that's the columns. So here we have them. These are the columns. These are the columns. These are the columns. The little space of muscle that part of the cortex that extends to divide the pyramids inside the medulla. So let's see what's happening right here. Extensions of the cortex that deep into the medulla. It separates the medulla. Remember, these are columns that separates the spaces. So that's what we can see, the shape of a pyramid within the medulla. So right here, renal sinus, hollow chamber in the middle depression. So this is nothing else than, let me see if I have it here. Renal pelvis, renal vein, renal capsule, renal column, renal pyramids, the ureters, the papilla, the sinuses right here. These spaces in between, see? In between the calyces, the tubes that drains the urine from the pyramids. So that will be the sinuses. Remember, sinuses are spaces. Now here are the sinuses. Here are the sinuses. Here are the sinuses. These are not part of the columns. No, they are attached to the columns. Sinuses. Don't worry about that. That's not something that you will be asked, but just for you to know. So that's basically what it is. So here we have the small little tubes, minor calyces. Then we have the major calyces, which are the larger tubes. See, here we have very small that connects with the large one. Small and connects with a large one. Small connects with a large one. Small connect with a large one. And all of them drain right here in the renal pyramid, or pelvis, my bad. And then the ureter, the urinary bladder, all the way down to the ureters outside. So here we have the ureter. That's it. So that's how all these structures work. So this part, not too complex. But what we're going to see that has lots of complexity is going to be these structures within the pyramids and the cortex, or the medulla and the cortex. That's going to make it a little more complicated. So these ones, see, these are the microscopic structures. That's going to be a little different. So here with all these structures, these are the major structures, something that we can see. These are large structures internally within the kidneys. But once again, now we're going to see the microscopic structures, because the functions of urine formation happens within the small structures. So we're going to talk about these cell, the basic structure cell that makes up the kidneys, that we're going to call the nephron. Remember, the cells that makes up the nervous system is called the neuron, but the cell that makes up the kidneys is called the nephron. Nephron. So we're going to talk about that, and we are going to break it down and all its parts, because the nephron is a cell, so it has parts. Remember, we used to talk about the cell membrane, the cytoplasm, and we talk about the nucleus. But here, we're going to talk about something different, about these cells. So once again, this is the microscopic structures. We're going to see them. So your information. So this is the part that we are going to actually pay attention and focus a little more, because this is the real deal. This is what actually works to remove all these waste products, including fluids, from the blood through this process of urine formation that takes place within the kidneys, but inside these cells that makes up the kidney. And these cells are called nephrons. So don't forget this, because this is important. Don't confuse, don't mix nephrons with neurons. Neurons has to do with the nervous system. Nephrons with the kidney. So that's basically what it is. So these nephrons have different structures. We're going to see them. So all these structures, we're going to describe them, and we're going to talk about what happens in each one of these structures and how all these three processes of urine formation are taking place in this tiny microscopic cell that makes up the kidneys. Each kidney has 1 million of nephrons. In other words, each kidney is made of 1 million nephrons. Million. So each one. So we have 2 million nephrons, 1 million on the right kidney, 1 million of nephrons makes up the left kidney. So that is the reason why if one kidney fails, the other one takes over. We can work with just one kidney. That is okay. That's what you can donate a kidney if somebody else needed, and we're willing to donate one kidney because our body can function with one kidney as long as the kidneys are working in a normal state. So that's basically it. If they are normal, they have no problems, I have no kidney conditions, I can donate one kidney to a person that has kidney failure, meaning his or her kidney, their kidney, is not functioning. So we can donate one. But remember, it has to be compatible. If you are donating a kidney to a member of your family, that goes through a process, remember. Some blood analysis to see the blood type and that it can be compatible, because if it's not compatible, it's not going to work. So that's basically what it is. And you have to be in good state of health, meaning 2 of your kidneys needs to be working perfectly. Because if I remove one kidney to you and that kidney, the other kidney not functioning properly, what is the purpose? No, your 2 kidneys must be working normal. Otherwise, you cannot be a donor. It's not accepted. So 1 million of nephrons makes up each kidney. And that is the place where all this urine formation is going to take place in each one of these nephrons, and they are microscopic. But because we have 1 million in each kidney, they're going to do the process of filtration, okay? Reabsorption and secretion. Now, each nephron is going to have a glomerulus. It's going to have some tubules. And those tubules is tubules, not two tubes. It's tubules. That's what it's called. It's tubules. But those tubules are a little different in each section. Remember the small intestine and the large intestine. They are different. They have different functions. Well, the same here. Tubes or tubules that are going to have the process of reabsorption, and tubules that are going to have the function of secretion. Just like the small intestine. Absorption, but here it's called reabsorption. The large intestine, which will be excretion, but here it's going to be secretion. Remember, secretion means within internal organs. Excretion is outside of the organ or outside of the body. All this secretion happens inside the kidneys. Remember, inside the nephrons. For that reason, we call it secretion. Now, reabsorption is a different issue. Don't mix them up with absorption, because absorption is one thing, reabsorption is another one. We will discuss that. So we're going to go through all these three processes, and we're going to talk about where do they take place within the nephron. Well, we know the glomerulus, but we're going to discuss the glomerulus. We're going to discuss these tubules. What is the name of these tubules? Because each tubule is going to have a name, just as the small intestine. And the small intestine is divided in duodenum, jejunum, and ileum. Well, these tubules also going to have names. So just keep in mind that the cell, the structural cell that makes up the kidneys is called the nephron. The nephron. And within the nephron is when we're going to have these three processes of urine formation: filtration, reabsorption, and secretion. So here it is, one nephron. So this is a diagram of how a nephron looks like. So if you look on the bottom part, it says right here the three processes: filtration, secretion, reabsorption. But we're going to see which one is it and where each one of them takes place. Because remember, all these three processes do not happen in the same place, in the same structure of the nephron, because it has different structures. See, it has right here the glomerulus. Then it has all these tubules, but these tubules change names as they move further. So we're going to see in which parts of this nephron actually each one of these functions takes place. Every single nephron, remember, we have 1 million nephrons in each process. At the same time, when blood is passing through these particular structures. So we have blood right here coming into the body. See, this is the dirty blood that enters this tube, enters right here the glomerulus, which is all this mesh of capillaries right here inside. It's like a filter. And blood passes through these filters. And what is it that the filters do? Filters removes all the wastes, and clean blood moves through this blood vessel and goes back to the system. And dirty blood, all the wastes are filtered through these tubules because they are going to become urine. And then gonna leave the kidneys, they're gonna leave the body, and we are going to have urine formation now. So that's how it works. So the blood that is already being used, remember, just like in the heart, the blood that has no oxygen enters to the right side of the heart through the superior inferior vena cava. That's basically how it is. That was one of the chapters that we covered first. And then it passes through all these chambers and moves to the lungs, when the lungs is going to do the gas exchange. Well, no different right here. Blood is going to come right here to the glomerulus. Let's say the glomerulus are the lungs. Here, blood is going to be filtered because this is a filter. So the blood that is clean is going to move to the left side of the heart, right? And then to the aorta to be distributed to the entire body. Well, here the blood is going to go back to the blood flow through the arteries. But the dirty or the wastes on the urine is going to go through these tubes to be removed from the body. From the kidneys first, and then outside the body. So that's how this is going to work. Let's talk about first the glomerulus. So here it is, the glomerulus. Remember, the glomerulus is nothing else than a kind of mesh, a bunch of capillaries right here. It is right here in this area. But this glomerulus has to be protected. Now it says right here, glomerulus. This is a mesh, a net of capillaries, just like a filter. Think about a filter, the coffee maker filter, or any other type of filter that you might think of. So blood is here, it's going to be poured through this filter. And whatever doesn't passes through the filter is going to move through this tube. Whatever passes through the filter is clean blood that is going to move through these tubes. But these glomerulus, because it is a net of capillaries, the capillaries should not be exposed. So they have a capsule that protects them. See, every single structure has a capsule. And within, we're going to find the capillaries. So this capsule is called the Bowman's capsule. And it protects the capillaries. That's very important. Now, are you going to be asked this in an exam? No. But you need to understand how urine is produced. What is the purpose of me talking about the nephron? Oh, that's where... No. You have to see every single structure just for you to understand the process of urine formation. Because we didn't know, right, how urine is formed. We just know that we go to the bathroom whenever we feel like we want to pee. But that's not it. This is not exactly what's going on. We need to know what is going on with our body, how all these structures function. And what happens when we pee too much? When we get up at night and go pee all the time. Oh, is that normal? What happens when we cannot pee? But when a little pee comes out, but you feel that still you have your bladder full. Said, I feel like you're gonna pee more, but nothing else comes out. What's going on? Well, we're gonna see some of these conditions. That's important. Why do the little kids pee themselves in the bed at night? Oh, wait a minute. It's gotta be something. Yes, those are conditions. So we're gonna talk about what causes all that. So this is a capsule that protects the glomerulus, which is the filter within the nephron. So this filter is very important. If this filter lets pass things that the body doesn't need or that the body needs, so hey, it's because there are certain particles that are large. They cannot pass through this filter. But then within these tubes, we're going to pick up again those things that accidentally passed through the filter or didn't pass through the filter. So that's how we're going to do it. Remember, sometimes when you have, if you drink coffee and you prepare your own coffee and you have a coffee maker and it has a filter, sometimes you're going to find some coffee grains within your coffee cup. It says, oh, wait a minute, what is this coffee grain right here? I filter it. Isn't it the filter is supposed to be retaining all these large particles? Well, not always. Now, the filters are not perfect. The filters are like anything else. They get damaged. So they might allow to pass things that are not supposed to be passing. So then we're going to see them we're not supposed to be seen. So then we're going to move them back to the blood flow, or we're going to be removing them. That's called reabsorption. I will explain it a little better later. So this is the glomerulus. Remember this area right here, this kind of circle shape kind of, but it has the Bowman's capsule right here that protects this capillaries here where filter kits, let's say, like protects the capillaries, which is called the glomerulus, because it's a bunch of capillaries. Makes a filter, like a little mesh. So that's basically what it is. So filtration happens within the glomerulus. That's it. So that's what you need to understand. So where is filtration takes place during your information? The glomerulus. And what is the glomerulus? A bunch of capillaries that makes up a filter. Now remember, filters allow sometimes to pass something that is not supposed to be passing through it. Or vice versa. It retains things that it were supposed to be filtered, but it doesn't filter it. So then all those wastes supposedly are going to move to these tubes. So these are called the convoluted tubules. Now, what do we call it convoluted? Because they are going like around, like intertwining, twisting, if you will. So now we have it right here, like nice, but it's not like that. These tubules are convoluted, so meaning goes like this, like the intestines. So you say, how do I know? Well, we have to have a diagram so we can separate all its parts, so we can define them. So we can mark them and distinguish the different parts. So the glomerulus is the filter of not the kidneys, the nephron. But usually we said the kidneys in general. But it's the nephron who does the filtration within the glomerulus. And it's protected by this capsule that is called the Bowman's capsule. Now we have the tubules. Not tubes, they're called tubules. Okay, so I'm going to put them green because there's nothing green around. So you see these tubules right here. So this tubule that I'm going to mark in green, this is called the proximal tubule. It's right here. Proximal tubule. This is this tubule up to here. Now, after this tubule is going to be this one right here. I'm going to color different. Let's put this orange. This color right here. Oh, it's not marking anything. That's not good. Really bad. So we put it right here. So this color, no, this doesn't work either. What's going on with these colors? Tell me about it. Okay, let's use this. So this part, oh, this is excellent. See, this part right here is called the loop of Henle because it's like a loop right here. See, this convoluted tubule, this is the loop of Henle. Now, the next part is going to be, let me put it blue. This one is going to be the distal tubule. This is the distal tubule up to here. So all these will be the distal tubule. Distal means it's far away from the glomerulus. This is proximal because it's attached to the glomerulus. This is the loop of Henle because it looks like a loop. And this is the distal portion. And the rest, we're going to call it the collecting tubules. See, they have different names. So let's put it this color. So this is the collecting tubules. So let's refer these all related to the digestive system. So this part right here, all this is the small intestine up to here. This is the small intestine. So you have the proximal, the loop of Henle, and the distal portion of tubule. It's like the duodenum, the jejunum, and the ileum. And then the large intestine is this one. But this is called the collecting tubules. So anything that enters the collecting tubules is a waste, just like the large intestine. Everything that enters the large intestine is considered a waste. Now, everything that goes here is going to go out. It's going to go out the kidneys through the ureters, through the urinary bladder, through the urethra, outside. But before we discard all this, let's talk about reabsorption. So this is the secretion part. This is secretion. And where secretion takes place? The collecting tubules. Remember, these are the distal tubule. This is the proximal tubule, and this is the loop of Henle. That's basically what it is. So filtration happens right here with the glomerulus. See, this area right here filtration takes place right here. Secretion, it takes place right here on these collecting tubules. Now let's talk about reabsorption, because reabsorption is a little more complicated. What's going on right there? So let's start again. So we talk about already all these names of these structures. I believe there is another image that has the names of the collecting and the Lupo Henley, I guess. I don't remember much. I use these PowerPoint presentations. And I don't recall the last time that I used this. So let's see if it's right here. Nope, 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 no. It should be here. Okay, this is the renal tubules. No. It doesn't happen, but no worries. I'm being explaining it to you. So that's basically how this works. So let's talk about reabsorption. Then we recap this again so you can have a more clear understanding. Remember, this is like the digestive system. Things enters this way, something goes this way, through these tracts, through these tracts. So right here within this proximal tubule, remember that goes up to here. And the loop of Henle, but mostly the proximal tubules. So the proximal and the distal tubules are the ones in charge of reabsorption. So what is exactly reabsorption? Remember the small intestine. All the food that was digested, broken down in very small pieces, moves to the small intestine. Within the small intestine, these walls of the small intestines are going to allow these nutrients to go through the walls of the small intestine to the blood flow. Here, remember, this filter allows certain things to pass, others not. If it is very small, it's going to pass, and then it moves to the entire body, like the aorta. But here in this part, the glomerulus, remember the filter, if something passes as a waste, but it's not a waste, this is going to be sent back to the blood flow, like sodium, for instance, water, glucose. All those things that are needed, magnesium, anything that is needed that accidentally passes as a waste is going to return back to the blood flow. That's what is called reabsorption. Remember, it was filtered already. And it's assumed that if it was filtered, only whatever is not needed, only the wastes are going to be passing through these tubules. But it doesn't happen that, because sometimes good stuff passes through the filter. So we're going to return it back to the blood flow. But we're not going to return it back to the dirty blood. We're going to put it back to the blood that goes to the system. So as you can see right here, let me remove all these markings so you can see exactly what is being sent back. So reabsorption, remember. So sodium, it was here within the waste material. Now it's sent back to the blood flow. Water, it was here. H2O. And now it's being sent back to the blood flow. See, that's called reabsorption. Because already was supposed to be right here. These are good stuff. but the filter did not allow those things to pass. So therefore, they went on the wrong track as a waste, but we need to pull them back. Remember the example that I gave you yesterday? Let's say that I give you a test. You didn't pass the first test. So I'm going to give you a second chance to retake it. Retake. It's not that you're taking the test for the first time. You are retaking the test. So this is exactly what happens with these distal, loop of Henle, and the proximal tubules. Whatever entered to these tubes is going to be, if it is needed, if the body needed, they are good stuff, is going to be sent back to the blood flow. So that's basically what it is. Now, whatever passes through this blood, through the blood, but then the blood doesn't need it, it enters the blood because it can happen either way. Enter to the tubes as a waste, but it wasn't a waste, put it back to the blood flow. But something was not filtered correctly and it passed through the bloodstream, to the blood flow that was already filtered. Oh, wait a minute, something went through the filter. Not good, we need to remove it. Well, we pass it back. So it is, that's the way it is. So what is it that we are gonna return to the waste pot? Nitrogen, see? Nitrogen. It went accidentally to the blood flow. We are returning to the waistline. See, that's how it works. Hydrogens. Oh, we have too many hydrogens right here within the blood. Accidentally went through the filtered blood already. No, we're going to send it back to the waste pot because we don't need it. But calcium, see, it's good. So from here, calcium is going to be sent back to the blood flow. Nitrogen is a waste. That's part of the urine. The urine contains nitrogen. Nitrogen has hydrogens. Remember, it's nitrogen and hydrogens. So we don't need them. We have to remove them. So all the wastes, if you accidentally move to the blood that was filtered, is during this process of these tubules, is going to be sent back to the waste tubes. And if it is good, it's going to send from the waste tubes back to the blood flow. That's what's called reabsorption. Something that already was filtered, but was filtered accidentally, moves back again to where they belong, whether to the waste tubes or to the clean blood that is running through these blood vessels. That's what's important here. Now, whatever happens right here on this last part of the tubules, that is called the collecting tubules, is going to be urine. See, right here it passes, right here it passes, everything is going to become urine. You cannot return anything else. After you reach this point, that's it. It's like the large intestine. Stools do not go back. Wastes do not go back to the small intestine. Oh, something went wrong. No, it doesn't. So that continues to the outside. So this is the process of filtration. So I hope that you guys kind of a little bit understand this, try to make it as easy as possible so you can understand this. But one of the things for sure that you're going to be asked is, what is the name of the cell that makes up the kidneys? It's called the nephron. And what is the function of the nephron? Well, it has all these functions. Urine formation. So remember, filtration, secretion, reabsorption. So filtration, reabsorption, and secretion. Secretion should be the last one. Remember that it is secretions, not excretion, because it happens inside the kidneys, inside the nephrons, inside all these tubules. That's basically what it is. That's secretion. Something that is sent to the blood flow, secretion. Something that is sent out, excretion. Remember that all these processes happen within these cells inside the kidneys. We're not talking about the urine that is formed and it goes outside from the urethra. No, these all processes happen right inside the kidney. Then you have to go through all these channels from the renal pyramids through the minor calyces to the major calyces to the renal pelvis to the ureters to the urinary bladder to the urethra to the outside. That is another process. Talking about urine formation, which is within these nephrons. So filtration happens within the glomerulus, reabsorption within the tubules, the proximal and the distal, and secretion within the last section of these tubules that's called the collecting tubules. So that's basically what it is. Any questions about this urine formation? Remember, just simple, where is filtration takes place, where is reabsorption takes place, where is secretion takes place. But in general, it's just all of them happens within the nephron. And what is the nephron? Part is what makes the kidneys. These cells makes up the kidneys. Think about each nephron is a brick that your home is made of. See, all these bricks, one brick means nothing. One brick doesn't, oh, I have a brick, I have a house. No, I have to put all these bunch of bricks together. Now we form a wall, 2 walls, 3 walls, 4 walls. Now I have a complete room with all these rooms. And then I put a roof in there. Oh, now I have a house. The same here, the kidneys are not one nephron. You have to have all these nephrons, and next thing I know, I have a kidney. And how many nephrons do I have to have in each kidney? 1 million per each kidney. That's how it is. That's how I want you to understand it. And each one of these bricks plays an important role, because in each one of these bricks, which is one of these nephrons, all this urine information happens. So if I collect all the wastes, all the urine information from each one of these nephrons, that's why we have all this urine. But one nephron, we couldn't even see it because it's microscopic. So how are we going to see what was the waste that this nephron did? But the collection of all of them, now we're going to see all this urine. So that's basically what it is. So if you drink too much liquids without the need, because you don't need it, well, what's going to happen to this filter? This filter is going to be working too much. It's going to be damaged. So next time it's going to allow to pass things that are not supposed to be passing. So the kidneys are going to be working hard. All these toxins are going to be damaging the kidneys. That's why you have kidney failure, because you're putting your kidneys to work too much when it's actually not needed. So basically, that's what it is. Remember, most of the things depends of how we behave, how we do things, our diet. Moving on. Any questions about the nephron? The process of filtration, secretion, and reabsorption. Now let's talk about the structures, because we now live in the microscopic structures of the kidney, because it's within the microscopic structures where the urine is made, it's formed. So now we have the ureters. Remember, the ureters are these tubes that drains the urine from the kidneys to the urinary bladder. That's it. It's it right here. Function, it drains urine from each kidney, renal pelvis, to the urinary bladder. That's it. That is the definition of the ureters. These tubes. And what is the function? They collect the urine that it is formed within the kidneys, and then they drain it all the way down to the urinary bladder. Very simple. So what it is really complicated, or a little more complex, is the urine formation within the nephron and all these glomerulus convoluted tubules and all the different names that it receives. So basically, that's what we need to understand. So these are the ureters. See, this is a real kidneys. This is a cadaver. So from here, a cadaver, from here is where we have all these. So these are the kidneys. And here we have the ureters. Goes all the way down from each one of the kidneys. These are the ureters, all the way down, and here they encounter the urinary bladder. And then the urethra. So these large structures are very easy to define. So not a problem. So you need to know definitions. What are the ureters? Oh, the tube that drains urine from the kidney through the urinary bladder. That's it. Now we're going to see what is the urinary bladder, right? Because it's the next one. The urinary bladder. What is the urinary bladder? Okay, this is an elastic muscle. It's an organ, of course, just like the uterus, the stomach. When it says it's elastic, because it stretches. See, you can hold up to 150 milliliters of urine within your urinary bladder. So that's basically what it is. And what is it that these sac, this organ, this urinary bladder do? What is the function? Storage of urine before voiding. Remember, voiding means peeing, urinating, micturating. The urinary bladder does not produce urine. This is like the gallbladder. The gallbladder do not produce bile. It's a storage spot. So when you have your patient that comes to your office and the doctor orders urine, of course you're gonna tell them, can you please, I'll give you this little cup. Go to the bathroom, collect me some urine, and you bring me the cup right here to the lab, okay? You do not tell the patient, can you go void and then come back? Because this language, we don't use it with them. Remember, we do not use medical terminology with our patients. We do not. The doctor said that you have myocardial infarction. Seriously? We don't talk like that. Oh, you have a heart attack. Remember, we use layman terms to explain to our patients. Our patients, regardless whether they went to college or not, we don't talk to them like that. How do we know? Do we first ask, oh, do you go to college? Do you happen to go to the university? Do you take anatomy and physiology classes? Do you take medical terminology? No, we don't. But we know that we are not using this language with them. That's it. Simple. So this will be the urinary bladder. You don't have to go through every single detail about how this urinary bladder works. No, it's just like a sac that receives urine from the kidneys through the ureters. So here we have the urinary bladder. Now remember, this is a frontal cut of the urinary bladder because we cut it front and back. So here we've seen the back of the urinary bladder. This is the back. Now, here you see the ureters entering the urinary bladder on each side because we have two kidneys. So they come from here and the other kidney, oops, and they come from here. So that's basically what it is. So all the urine start going down and fills this part first. And keep on this way. When we reach like half of the urinary bladder, when it's half full, that's when you have the sensation that you want to pee. But it's not an urgent thing. It's not an emergency. It's not something that you have to pee. This is when you feel like you want to pee, but you still can wait. Remember, this is like the bowel movement, right? Stools. You feel like you want to go to the bathroom, but you know that you still can hold. Same here. Now, when you get 3/4 of the urinary bladder full, now you feel like you have an urgency. I need to pee. I need to look for a place. Still, you can hold on a little bit. But now when it's full, there is no way you're going to pee yourself if you don't find a place. So that's how this happens. Because as this fills in, remember the chambers of the heart, as they fill with blood, pressure increases inside. And I need to do something. So this starts squeezing and pushing this urine through the urethra. Pushing right here, and there is a sphincter right here. So right here in this area, we have a sphincter right here. Otherwise, the urine will come out as soon as it zips right here. No, it's start filling urine. Urine is not going to come out. Urine is not going to come out regardless of how much urine you have in there. But the pressure is increasing because this is like a balloon, inflating. But you have a limitation. You inflate until it bursts. Well, the urinary bladder is not going to burst. What it does is it's going to relax this sphincter and urine start passing down. That's how it happens. But the brain sends a signal. So these muscles start contracting, squeezing, like this. Then if it squeeze, the urine has to go back to this sphincter. The urine is not going to go backwards. Unless you have a problem with the sphincter and you develop urine retention, meaning that the urine doesn't pass and filling urine, well, It comes right here. If the urine doesn't have an exit to the lower level, it's going to go up. That is going to be really bad. So it's going to damage your kidneys because it goes back to the kidneys, the urine. And remember, the urine, if it stays in this place, just like the stools, stays for too long here, it's going to rotten. Bacteria is going to grow there, and you're going to infect all the organs. That's how you have infections. That's how you have cystitis, which is inflammation of the urinary bladder. Because urine stays right here for a prolonged period of time, because you're not peeing normally. So all this urine right here is going to cause you an infection, because this urine is going to rot in. Think about this. Urine smells really bad after a few minutes that is outside. Can you imagine staying here for days? It's going to damage. It's going to damage the mucous membrane of the inside of the urinary bladder. Now, remember when we were talking about the male reproductive system? Here we have this particular gland. Remember the prostate gland. See, it is surrounding, is around the urethra, below the urinary bladder. So this is the prostate gland. So what happens when males develops BPH? BPH is hypertrophic prostatic dysplasia, BPH, or hyperplasia. So it becomes very large, that squeezes the urinary bladder. See, the urinary bladder has all this space right here, but it squeezes so much that compresses against this, urine cannot pass down. That's what males after 45, 50 years old, sometimes they have a problem. Well, the prostate not always enlarged. But most of the cases, in let's say 85% of the cases, males after 50 develop this enlargement of the prostate. That's what is written here. The prostate gland lies inferior or below the male's urinary bladder. Now, remember, it's the male's urinary bladder. Females do not have a prostate. So this causes a problem. If this prostate becomes enlarged, because it constricts this little tube that drains the urine, now urine gets stuck right here. So now I have to put the catheter and remove the urine from there. So that's basically what it is. That's why these questions are crucial. It's important that you understand, the prostate gland, because it causes some medical conditions, very common medical conditions. It's very frequent that this happens. See, a male enters in your office. See how important it is that you need to know the age of these people. By just looking at them, you know that they are a very young person or old person. But you have the medical records, or you have the ID that you're going to ask when they come to your office, if it is the first time. I need to make an appointment with the doctor. Okay, what insurance do you have? Oh, I have this insurance. Okay, I make sure that we have take that insurance. Then what seems to be the reason of, oh, I have problems urinating. I cannot pee. Oh, I'm going to pee and I pee very little. Then I feel like I want to pee more, but no urine comes out. So problems urinating. Oh, already have these ages over 50, 40, 50 years. Oh, probably has BPH, benign prostatic hyperplasia. Oh, wait a minute. I need to collect urine. I need to prepare something. Probably the doctor is going to do urinary catheterization, or the doctor is going to send this patient to a urologist. So I'm preparing myself for referrals to collect urine to do this. So those are the importance of these lectures. It's not just talking and talking and talking and telling you stories. No, it's how important it is this on your workplace, hands-on practice. Because this is correlated to wherever conditions your patients are going to come to your office for. But if you're not understanding any of this, well, placing, oh, I have a problem urinating, what the heck, it's not my job. Then you're not prepared. You don't know what is the next step. What is it that you have to do? Oh, I'm waiting. This patient is going to get this. I'm going to wait because the doctor is going to call me. Instead of getting caught up doing something else and then leaving that without completing it, I'm going to be on top of the doctor. Do you want me to collect some urine from this patient? Are you going to need a referral for this patient? So I'm prepared. I'm prepared in advance. That's how it works. But if I'm not paying attention to any of this, I'm not going to be able to do well in my job. And you're going to think that it's too much of the work. Yes, it is. But when you have the knowledge, you know what to do, then you will be ahead of the game. So this is the urinary bladder. Remember, very important, this is just a storage for urine. That is it. Now we're going to see the next structure, which is going to be the urethra. And you see the urethra passes through the prostate in males. For the females, not a problem. So the urethra. Now pay attention to the anatomy of males and females, because that has a very, very defining point for certain type of diagnosis. So what is the urethra? The urethra is this tube that drains urine from the urinary bladder to the outside of the body. That's it, period. Now pay attention, because right here it says females, males urethra. Remember, males have a penis. So therefore, the urethra is going to be longer. That means that males develops less infections. They are at least risks of developing urinary tract infection because of the length of the urethra. Now, for the males, because there are more things, it has a dual function. So the urethra in males has a dual function because urine passes through, but the seminal fluid as well. Whereas females, no, the urethra is one canal, just a tube to drain urine. Anything else doesn't go through that. Reproduction is not through the urethra. So those are very important points, that the physical structures of the males and females makes the whole difference, particularly when it comes to infections to the urinary tract. Now, the female's urethra is very short compared with the male's urethra. You don't need to know the length of the female's urethra and the male's urethra. You just have to think that, oh, the male has penis, therefore the urethra is longer. Now, the female's urethra is so short than external urethral orifice anterior to the vaginal opening. So, because so close to the vaginal opening, and the vaginal opening and the urethra is very close to the anal canal, well, feces from the anal canal can be moved, can be passed very easily to this area, the vaginal canal or the vulva, the labia. And remember, feces are waste. That's what causes most of the urinary tract infections in females because it's so short. So when the patient wipes after moving their bowels, if you don't wipe correctly, you wipe yourself from back to the front. So from the anal canal, you wipe towards the vagina, the orifice of the vagina, the entrance of the vulva, and all those external and internal structures of the female reproductive system. You're going to bring these feces right here. Well, that's going to cause you urinary tract infection. That's why when you wipe, you need to wipe front to the back. So you wipe the anal canal, you don't do it this way, upward, because here it is the reproductive part. You do it this way instead. So that's very important. Because otherwise, you're going to be constantly developing all these urinary tract infections, particularly urethritis, cystitis. So these are the things that are important because whenever the doctor gives the patient a diagnosis of cystitis, usually females, then it's because of this. It's not that we are against women. It's always saying that the female have this. No, it's because anatomically the structures are predisposed to get these conditions. And we have to be aware of that. And we have to give instructions to our patients when they need to collect urine to us, how they need to clean themselves before they collect the urine, how they can prevent getting a urinary tract infection. Because remember, every single time that we collect urine, it can be for two reasons. Well, might be more than one reason, because urine is one of those body fluids that we use to diagnose patients. But in most of the cases, the patient complains about having some burning sensation during urination. So the first thing that comes to mind is, hey, you have a bacterial infection. So that's basically what it is. Because of the anatomical structures that are so short in the connection between the anal canal and the reproductive organs. For males, it's a little harder. It's not going to happen that way. Now, elderly happens for other reasons. That's hygiene problems and things like that. But here is just a different picture presentation. So that's what is important. Remember, it's the application of all these lectures to our workplace. What helps us out to understand. Because remember, the patients are going to come over. If a patient tells you that they're having burning sensation during urination, you have to be ahead of the game. Even though if the doctor doesn't order urine, you're going to tell the patient, Mr. and Mrs. Smith, if you happen to want to go to the bathroom, let me know, okay? Because I want you to collect some urine. Whether the doctor is going to order or not, 100% the doctor is going to order it. And the worst thing that can happen to you is that the patient tell you, where's the restroom? And then you tell them, oh, it's right there, blah, blah, blah. Give directions, and then you do not collect urine. After they told you that they have some problems with urination. Now the patient is going to come over after they see the doctor, and they come with an order that you have to draw blood and collect urine. Surprise, because the patient, when you tell them to collect urine, said, oh no, I went to the bathroom. Why didn't you tell me? Oh, I didn't know. Well, that's not the answer. You did know. If a patient comes for a complete physical exam, I know the patient is going to need urine, blood, EKG, whatever other things. I'm going to collect urine. It's not like every single time a patient comes in. Patient was here last week, 2 weeks ago. Am I going to collect urine? Only if the patient is complaining about problems about urine. Otherwise, do not collect it. You're going to save so much trouble, time. So now you have to wait until the patient is ready to go pee. You're going to ask the patient to drink lots of water. The patient probably doesn't want to drink. Probably the patient doesn't want to wait. Oh, I have to do something else after here. No, I have to go. Well, now you have to wait until next time that the patient comes in, or just stop by to drop the urine. That creates a problem for the doctor, because now the doctor is waiting for that urine to analyze that urine and to give the answer to the patient and to treat the patient if it does need it. Now we are delaying everything. Now the patient is going to have to come back again. Put yourself in the patient's shoes and think about all these hassles. Just because we are not focusing on our job, because we don't understand any of this. See, I tell you all this because I work in the medical field. I used to have nurses, other people working under me. So that's what I need, and that's what I explained then. And it's that makes all these workflow work so easily. Because remember, you don't have one patient. We have several patients, maybe many patients. And to be handling one patient, dealing with one patient that we didn't collect the urine for some reason, now it's going to back you up with other patients. Now you're going to become very aggressive. Now you're going to become, well, think about all the things that is going to go through our minds. So knowing these things are going to facilitate, once again, how things are going to function in your favor, in your workplace. So remember, these classes, for my classes, are not just talking about these structures and that's it. No, you need to apply them to the medical, to what you're going to be doing. That's why sometimes you take courses, and when you start working, there is nothing like it. Oh, I took this, but now I have to apply it. I didn't know that. No, I have to tell you everything that comes with learning these classes, because this is going to be applicable to whatever you're going to do. So now that you're going to be working as a medical assistant, then you're going to be going through all these situations, and it's going to facilitate, it's going to make it so much easier for you. That you're going to go there and you feel that you've been doing this before because you know how to handle it. That's what's important about these classes, not just to tell you all of these, know how it functions, this, that, no, how you apply it to your job. Any questions about these structures of the urinary system? Any question at all? Good. And I'm not getting upset, okay? I'm just telling you what is important. Don't think, that teacher was kind of, scolding us, blah. No, by no means. Just telling you what is important about these chapters, not only to just cover something and reading something back to you and explaining how all these structures works and how they are made of, what they consist of, but how are you going to apply this to your work? That's really important. Well, let's talk about these urinary disorders, or renal and urinary disorders. Remember, renal means the kidneys, pertaining to the kidneys. Remember, ren, kidneys, AL, pertaining to. Urinary, urine is the urine, the waste, ari, pertaining to. So disorders. So here we're going to talk about something that 100% you're going to have it in your test, like maybe 3-4 questions. UTI, urinary tract infection. Listen, you bet that you're gonna get this. Because it's a very common thing that happens. And females are the ones that are more at risk of developing this. So be familiar with urinary tract infection. Usually they call it UTI. Remember, UTI, urinary tract infection. So we're going to have more to this urinary tract infection because they're going to ask you, okay, what causes urinary tract infection? So the first thing that you have to think is bacteria. Bacteria is the most common cause of urinary tract infection. But what type of bacteria? E. coli. This is the name of the bacteria that it is the most common offender that causes urinary tract infection of UTI. Now, one particular thing about this bacteria is that this is the gram-negative bacteria. Why? Because we have gram-positive and gram-negative. Bacteria that is gram-positive is a good bacteria. That's the one that we call Staphylococcus. These gram-negative bacteria, we went over this during medical terminology when we were talking about these bacteria. We didn't mention E. coli much, but we just mentioned gram-negative bacteria and gram-positive, which is staph and strep, Staphylococcus and Streptococcus. These are the bacteria. So this is called by Streptococcus bacteria because it's the gram-negative. And Streptococcus, Staphylococcus is the positive. Just because it says positive does not imply that it's a bad thing. No, Staphylococcus is a good bacteria. It's the normal bacteria. That is the bacteria that protects our entire body. It is everywhere, inside the urinary bladder, inside the intestines. It helps us to protect these linings of our structures. It lives within our body, on the outside and on the inside. Whereas gram-negative bacteria, it doesn't live with us. If it lives with us, we're sick all the time. It shouldn't be. Now, one problem that we have with Staphylococcus, gram-positive bacteria, is that if this bacteria enters an area of our body, our structures, our organs, where they do not belong, now they're going to cause an infection. So that's basically how it works. So let me give you an example. We have Staphylococcus right there on our skin. Millions. Our skin is covered by all these Staphylococcus. They are not causing us any problem. They're protecting us from other invaders because they eat whatever try to invade our skin. But what happens if you develop a little cut, a little break on the skin? Well, if we develop that type of trauma to our skin and we do not take care of that, we do not clean it, we do not put some antibiotics, well, that infection is going to go inside the cut and it's going to cause us an infection. That is a different issue. That's a different issue. But in general, 98% of the time, it protects us. Gram-negative, 100% of the time, cause us damage, infection. So here, you're going to know this. When we get to phlebotomy class, then we're going to discuss this test that we ordered, which is the midstream clean catch test, which is collecting this urine in following certain directions, because we're going to prevent that, because that's the way that we collect urine when we suspect that they have UTI. Has to be collect the urine differently. You can't just collect the urine. Oh, go get me some urine and that is it. No, it is done differently. So for now, E. coli is the most common offender that causes UTIs. And what is E. coli? A gram-negative bacteria. Very dangerous. So that's basically what it is. So what type of bacteria is the urinary tract infection? Urethritis, which is inflammation of the urethra. Remember, this is the first tract that connects with the urinary bladder. So if infection enters, the first tract that is going to be infected is the urethra. And if you do not take care of that, or you not receive medical care for that, then it's going to move up. So infection moves from the outside to the inside, the urethra, the urinary bladder, and here cystitis, inflammation of the lining of the urinary bladder. And if you don't control the infection right there, it's going to move to the ureter, the ureters, then to the kidneys, and that is it. You're going to damage your kidneys. So don't forget about these things, because urinary tract infection is the most common infection of the urinary system. Remember, acid reflux, heartburn, esophageal reflux is the most common condition of the digestive system. URI, like the flu, this common cold, is the most common condition of the respiratory system. Anemia, the most common condition of the circulatory, of the blood system. Because these are the things that we need to know. What is the most common thing? Because if it is the most common thing, it's the things that the patient is suffering the most. And that's how we are going to find out the answers for our questions. What is most common? How to treat it? How to avoid it? What is the most common diabetes? Diabetes type 2. So that in context is what we need to kind of go over and over and over and make sure that you keep in mind these definitions, because are very important. So they usually give you medical terms. What is cystitis? Oh, inflammation of the urinary bladder. What is urethritis? Inflammation of the urethra. Any questions about these urinary disorders? We just started. We're going to see a little more. So it's important for us to understand how this works. Let's talk about these urine volume disorders. These are medical terms. So when we talk about urine volume disorders, not necessarily means how much urine you pass out, but instead how much urine is being produced by the kidneys. So let's talk about anuria. Anuria. Remember, urea means urine, AN means without, absence of urine. So once again, it's not that you are not passing urine, you're not peeing, let's put it this way. Yes, it is, but it's not because the urine is within the urinary bladder and doesn't want to go out. See, that's the difference. This means that your kidneys are not producing enough urine. So that means that your filter is not allowing to pass anything. There is damage with the glomerulus. There is damage with the nephron. So you're not producing urine. You're not removing the excess of fluids. Wastes. Something is wrong with these structures. So that's why you not produce urine. Remember, it's not that urine is not coming out. It's you don't have it. It's not within the urinary bladder. Oh, I feel like full, like I want to pee, but nothing comes out. That's not what I'm talking about. Not at all. It goes to this main organ, this main structure, the kidneys, the nephrons. They are not producing urine. The filters are not working. So you're not filtering anything. Everything goes back, the dirty blood goes back to the system. So that's anuria. Next, oliguria. Olig means little, small, scanty. So it is little urine. So once again, it's not that you just peeing a little bit. That's another thing. That's incontinence. That's something else. So here you're going to be like, okay, so little urine is being produced by the kidneys. Remember, anuria, no urine is produced. Oliguria, little urine is produced. So you pee a little because a little was produced. Now, polyuria. Remember these medical terms? Urea means urine, poly means a lot, much, lots amounts, lot volume of urine. So what happened here? Your kidneys are not filtering correctly either. They are allowing all the fluids to go out instead of returning back to the blood flow. So they are not doing the job correctly. So you are peeing a lot. This can happen also because you are drinking too much water and you're not active. You're not using this water. You're just drinking because you heard that water does the body good. That it's okay to drink lots of water. Remember that there is some guidelines out there that says that we're supposed to be drinking 8 ounces, 8 glasses of 8 ounces of water per day. Hold on a minute. If I'm sitting right here and I'm drinking all that water, I'm not using it. I'm not active. So the only thing that I'm doing is putting my kidneys to work to eliminate all this water. That's what I have to stand up every 5-10 minutes going to the bathroom. You know what I'm talking about when you drink too much water. Or when you drink beer. Beer is an antidiuretic. So antidiuretics are those who do not allow the kidney to retain urine. Instead, forces your kidney to push all the fluids out. And you pee a lot and very often. Is that good? No. Because when you pee a lot, it's not just the water alone that is going to be removed from the body. What about all these electrolytes? Oh, let's move back to the reabsorption part. See, here is where everything takes a toll. So here we have the reabsorption part. See, reabsorption within the tubules, right here. What about that sodium that it was supposed to go back here? Because I have too much fluids, it's gonna drag all this sodium, all this water out. All this potassium, all this glucose that I do need to pull it back is gonna drag them down. So you're gonna be removing stuff that you actually need in your body because you're draining it continuously. Let me give you a better example. A coffee maker. You have a filter. This is a coffee maker, has a filter right here. You have a coffee grains right here inside the filter. Pour water. So you put, let's say, 1 tablespoon of coffee grains right here. That is good, maybe, for 1 cup of coffee. But then you keep on pouring water and water and water. So what's going to happen to these coffee grains? At the end, it's going to only water going to pass. Very clear, because all these, the filter that coffee grains have already been unsaturated. Think about, you have a bottle of water right here. This is like 16 ounces, or 8 ounces, or 16 ounces of water. And you just put a little teaspoon of sugar. Is this going to be sweet? Not at all, because it's going to dissolve in all this amount of water. It's the opposite of this, but it's the same process. Now you put in something solid that is very little in this too much water. When you're going to drink the water, it's not going to taste like sweet. It's going to be water. And here, if you put too much water through this small amount of coffee grains, at the end, too much water is going to pass just the water. So that's what's going to happen in our body. That you're going to be drinking too much water. Well, that water, we don't need it because we don't retain water. That water got to go out. And that's what we pee every often. See, that makes sense? But when you pee so often, it's not that it's just uncomfortable, because you have to be getting up every single time. You can just move from one place to another place without going to pee. So let's say you kind of gonna avoid going far distance in a car or in a bus or in a public transportation because you're gonna pee. Very uncomfortable, isn't it? It's not just that. The problem is that you are damaging your kidneys. You are damaging your filters. You are removing electrolytes. All these chemicals that we need, you are removing it because you are dragging it with all this excess of water. That's the problem. So don't drink water just because you heard that the water is good. No, drink the water that you need. The more activity that I do, because you start sweating and you start using it, your muscles start using all this water. Now, the more activity that you do, the more water that you're going to take. How are you going to know it's enough? When you start going to the bathroom. Oh, it's making me go to the bathroom too often. I'm drinking too much water. Simple. So polyuria can be the factor, once again, that these anti-diuretic hormones are not doing the job because they are damaged. So they are not retaining, instead, it's coming down. Or you're drinking too much fluids without need. or your filter is not working, the kidneys are damaged. One more thing, enuresis. So enuresis, this is what we call involuntary urination. This is when the little kids urinate themselves at night in the bed. This is not because they want to. This is because they have some issues with these sphincters that connects the urinary bladder with the urethra. They are too relaxed. Remember, they are developing, they are still growing up. But it can be some psychological effects as well. See, we always think that we're doing the right thing with our kids. Let me tell you this. Sometimes we tell the kids, oh, you gotta go sleep. You cannot get out because you're gonna have some type of monsters coming to visit you at night. The cuckoo. I don't know. So many things, so many stories. So the little kids are scared to get up from bed when they feel that they want to pee and they end up peeing in bed. That's another thing. Remember, this is like polyuria, or you're producing too much urine because these antidiuretic hormones are not working properly. They're not retaining the fluids. So all these urine, all these fluids are going to pass as urine. Or you're drinking too much fluid here, or these sphincters with the urinary bladder are not working, or you're contracting too much because you're scared. Remember, when you're scared, your sympathetic nervous system makes your urinary bladder to contract. When they contract, squeezes the urinary bladder and urine comes out. There is no way you can avoid that. That's what is called involuntary urination. So we should not tell bad stories to our kids or tell them that the cocoa is going to show up at night if they don't go to sleep. And if they like keep themselves away with the phone or something like that, or something else. So they're going to be a little scared. When we tell them just not to get up from the bed, they're going to be scared. So they have the sensation that they're going to pee, but they don't want to get up from bed. They are under the sheets, right? But most of the cases is because, once again, these sympathetic nervous systems start acting up and contracting when they are not supposed to be contracting. These muscles, the urinary muscles, or the sphincter that is going to be relaxed. So they pee. That's what is called bedwetting. Remember, bedwetting. Okay. Any questions about this urinary system? Interesting. We have something else with the urine. I don't know what the slide's not here for some reason. I don't know. Remember, I was talking about incontinence. Remember, incontinence is also an involuntary loss of urine. It's not uresis. That's for the little kids. Incontinence is for adults. But it can happen because there are different types of incontinence. Whether the muscles that controls, once again, the urinary bladder are contracting too much and you pee, or because are stress incontinence, which is one of the most common. Remember, incontinence is when you involuntarily leak urine outside. That happens with age. I mentioned this before. It happens when the females are pregnant, because the females are fetus is growing and sits on top of the urinary bladder, which is on the side, but it squeezes it and forces the urinary bladder to, if you squeeze it and you have some urine right there, well, it's going to make increases pressure. So it's going to make the sphincter that separates the urinary bladder from the urethra to open up and urine comes out. So remember, some females, particularly, once again, this is very common in females due to that. It's the anatomical structures of females. Remember, when females cough, urine comes out. When they bend forward to lift something, when they scream, when they laugh, because increases pressure within the abdominal cavity, they tend to involuntarily release some urine. That's called incontinence. In the elderly, it's because now the parasympathetic nervous system is not working correctly. It's contracting when it's not supposed to be contracting. So it pushes the urinary bladder because it contracts, it squeezes the urine, and the patient releases urine. It is involuntary as well, but it's opposite. It is opposite to enuresis because this happens in little kids. The other one happens in adults. Now it's because there are some anatomical changes, some physical changes in the systems. That's a different issue. So that's called incontinence, remember. We're supposed to have it right here. I don't see it somehow. Okay, so any questions? Any questions? We can have kidney failure, remember? The kidney fails. Oh, how we didn't see that? Urinary infection, kidney failure. We almost forget this. I knew that I was looking for this. Remember, kidney failure, the kidneys fails to filter the urine, the blood, and make the production of urine, remove the waste, remove the excess of fluids. So that's kidney failure. Now it can be an acute kidney failure that happens for a period of less than 8 days or 12 days versus a chronic that it is a progressive damage to the internal structures of the kidneys, which are the nephrons. So this is the time, if it is chronic renal failure, then it's when you're going into dialysis. Then it's when you need a kidney transplant. Remember, dialysis is nothing else than removing the blood from the patient and passing it through these tubes, through this machine called a dialyzer, that filters, because the filters of the kidneys are not working. Now I have to filter this blood because it's contaminated. It has all these wastes. And these wastes should not go back to the blood flow because it's going to kill us. It's going to intoxicate every cells. And that's what patients who have chronic renal failure or kidney failure for, shorter, they're going to die. And to prevent this from happening, we put them through the treatment of dialysis. So that's basically what it is. So just in case that you have a question there that how you treat patients who have kidney failure, dialysis. Dialysis is, once again, filtering the blood in a machine that works as the kidneys, an external kidney that is called the dialyzer. Not dialyscope, is dialyzer. This is a machine that, filters the blood, and then when the blood is filtered, when it's clean, through another channel, brings the blood back to the patient veins that can be used back again. Remember, this process of dialysis lasts 3 to 4 hours, 5 maybe, 3 times per week. So a patient who is on dialysis cannot work. This is a patient that receives disability. How can you function? Very difficult. Okay, so I think that I covered most of the stuff. Any questions? We're done with this chapter. We're done with the module. So this is what's going to happen. I'm going to be sending you an exam. Remember, this is a take-home exam, so you're going to be working on it. Try to do to the best of your knowledge. When you need to verify, you have your reference notes. Go there, try to do your best, so you can kind of review this material and you become familiar with the type of questions that you might encounter on your national exam when you apply for the national certification. Remember, that's the key for these exams. So do your best. Don't leave this test for the last minute. You have plenty of time. I'm going to send it today, later on. Then you're going to have Friday, you're going to have Saturday, you're going to have Sunday, Monday. At any time during Monday, it doesn't have to be 5 in the morning, 6 in the morning. You have the entire Friday, Monday. Then you can return it back to me. I'm going to grade it and I'm going to send you your
Mr.
grades.
Hoya,
Yes.
I'm not receiving any emails from my email at the moment for some reason. So I don't know how can I send you the email the school gave me?
Yes, send me the school emails because I remember you asked me something and I sent it twice.
Yeah, I didn't get it. So can I give you the school email so I can get the test and the answers?
You have my email, right?
Yeah, I'm gonna send it to your email.
Send me your school email to my email and I will forward those questions that you asked me.
Okay, thank
Okay.
you.
Yeah, I thought you received it because I resent it a couple of times.
Yeah, no, there's something going on with my phone.
Yeah,
Thank you.
that's okay. Not a problem. Thank you for letting me know. I thought you just got it, not that you were having problems with the email. But remember, there is always safe to go to your what is called your spam folder, and sometimes emails goes there because remember, these are computers, they're not that smart. So sometimes an email goes there and the computer decides to send it to these spam mails. So usually when I send you something, I send it as a group. I have all your emails, but if you don't receive it, let me know. But check the spam folder because some of the times happen. One way to do that is going directly to the spam and opening that folder and checking for the email. But an easy way is to type my email right there on your email after you open it up at the search window, type my email. And if my email comes out, then all the emails that I have sent you will be there. So just, might happen with other emails. So make sure that you always do that. But once again, whenever you're having any issues with the receiving material that I sent, it's very important that you receive those materials because those are like reference things that you're going to be using. Once again, you're going to have these recorded videos that you can go back and review and something like that. But when it comes to exams and things like that, well, they're not going to be on the video. So you need to complete them. I don't want you to fall behind and, at the last minute, you're going to receive them when you probably not going to have enough time to complete this. So I'm giving you plenty of time so you can work in your own pace, because I know you guys are busy, you have a life besides school. So that's what I do, all the things that I do for you, sending you these exams in this way. So make sure that, yes, you confirm to me, and Send me your emails. Say, I'm not receiving this. Send me your other email. If the school email is not working, send me your personal email. But I'm only going to use it for this purpose. When you need something, when I have to respond something to you, because I want to have this communication with you. So I will be sending you an exam for this particular module. Remember, you had to return it by Monday. So I always give instructions on how to complete the exam if you're not familiar, how to return it, and when to return the exam. Also, I'm going to be sending you materials, probably not today because I have to go over certain materials to review them, that I have most of the stuff, and then I'm going to be sending you the PowerPoint presentations so you can have them for the next module that is going to be office practice, medical practice, something like that. So office laboratory procedure, something like that. So I'm going to be sending you that material and you're going to have it handy. And we're going to continue what we're doing lately with this course. We're going to meet at the same time and we're going to go over all these chapters until you guys are done. Any questions? So once again, particularly for Xiomara and I have another student. I just let's see if I can. I'm not seeing right now.
Is it Darlene? Is it Darlene?
Okay, yes, that is you, Darlene. Thank you. The two students that just joined this module, read the instructions for that is going to go within the test that you have to complete. How I want you to complete the test. Where do you have to do to highlight the correct answers, save those answers, and then send the test back to me. Write down your name and how to do all that. Always read the instructions because I always give the instructions to you. I don't want you to be taking individual pictures or screenshots from the papers because I want just the complete exam to be received because I have to send these to the school. They have to keep the hard copy from you guys. So I don't want you to send me little pictures here and there because it's a lot of work for me and not to mention for you. And then I have to send all these to the school and they're going to have each page individually as an EMG or something, pictures instead of having the PDF format. So it will be a lot easier. So just follow the instructions. And if you have any questions, remember my email is going to be there. So send me an email that usually I respond within 24 hours, okay? All right, so if you guys have no questions, we're done. We're not going to stay here just looking each other or anything like that because we have a lot of stuff to do, right? And I do have a lot of stuff to do to prepare you now your stuff that I'm going to be sending you later on. And you have something going on at your home. So going to see each other on Monday. Have a nice weekend. Thank you for participating in the class, attending the class, and enjoy your weekend.
Good night, everyone.
Take
Good
care.
night,
Good
Sue.
night.
Enjoy
Good
your
night, everyone.
weekend.
Okay. You too. Thank you. Good night.
Bye.
Good night.
Wine and chess this weekend.
Yes.
Good night, Mr. Hoya.
Good night.
I sent the email.
Okay.
All right.
Let me check. Don't go. Oh,
No, I'm
yeah.
still
I have it
here.
right here. This is my school email. Blah, 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 blah. Good night. Have a great day. Thank you. Goodbye.
All right. Good night, Mr.
Yeah,
Hoya.
got it. I will send
Have
it
a
to
good
that email,
weekend.
okay? You too. Take
Yes, have a
care.
good weekend.
Bye now.